This recent article made me very upset. The reason being that the people who are talking about the so-called Malar bag and festoon, that they made a comment here, they are misinforming and they are not giving the proper information to the people who are going to read this. Number one is that one of the celebrity had the Malar bags and she's young and probably she had either fillers or Botox done, that she has a Malar bag, she's probably transient, it goes away. I have spent last 30 years to figure out what the problem with the Malar bags and festoon are, and still majority of the people who are taking care of this patient, they have no idea what they're doing, and they are going to inject them with the feeders, and they do their non-invasive therapy, everything else to help them. What you have to know is that the general name for all of these items, which is a puffiness under your lower eyelid, is called Malar bags. The classification is that we classify them to the malar edema, which is allergic, malar mound, which is congenital, and festoon, which is because of aging process. Also, there is a lot of iatrogenic Malar bags because of the injection of the fillers in the people who were trying to correct this by the so-called non-surgical technique. The most important thing is that you have to know what is this content of this area, whether it's puffiness or whether it's fat or it's a muscle. You have to take a proper information and history from the patient. You have to know the onset of it. And the most important thing is that the plastic surgeon are frustrated with treating this because they don't know the pathophysiology, so they do not know how to correct this Malar bags, which is written in this article. The pathophysiology of the Malar bag, depending on classification, is different. What I have found also from 2019, which is almost 5 years ago, is that there is a fat that I find under the orbicularis muscle in this area. Orbicularis muscle is muscle around the eyes. I call it anterior septal fat. Anterior septal fat is not seen in everybody, but most people, like more than 50% of the people with the Malar bags, they have them, and it's completely different than the people who do not have a Malar bag when we do the lower eyelid surgery. And you have to go and you have to remove this fat in order not to get post-operative swelling at the site of the so-called Malar mounds or the festoons, because the fat has a lymphatics in it, and the lymphatics are responsible for the fluid collection. So my approach is that today, if I see the patient, and I see them every day, young one and old one. Young one, mostly they have a Malar mount. I do the short incision for them, and I have to release the ligament, and I have to do the tightening of the muscle and the lower eyelid. Older one, also sometimes I make a full incision. In the people who had the previous lower blepharoplasty, I make a short incision so I don't get pulling of the lower eyelid, called ectropion. You have to release the ligament and you have to tighten the muscle. And when the people talk about local excision of this, local excision is not going to do correction of the Malar mount. And the recent article which was published a few months ago, somebody was saying, we make a small incision and collect the Malar bags. That patient that they were showing even didn't have a Malar bags to begin with. So there are so much misinformation, and the people who are having this problem are desperate to get the right information and right treatment. So in summary, you have to know which category of the Malar bags you're talking about. You have to know pathophysiology. You have to know about anterior septal fat. And as far as I'm concerned, we published a paper last year. We were showing the outcome of our surgical treatment of the Malar bags. More than 60 patients of our patient had the previous treatment done, either regular lower blepharoplasty or injection of the fillers, fat, thread lift, all combination or non-invasive treatment with the microneedling. All of those patients are going to be harder to correct because they have so much scarring there. Malar bags are surgical treatment. Tetracycline doesn't work. All of those other so-called conservative treatment doesn't work. Either you should leave them alone, or you should go to the person who knows them and do the proper surgery and treat them. Sometimes after surgery, you might get some swelling. I put them on diuretics, and sometimes since they might have some fat over the orbicularis muscle, which is different than the anterior septal fat, I give them off-label Kybella, deoxycholic acid, very small amount, to get rid of the puffiness.